So, are we ready to start then? I'll take
yes,
that.
Michelle, we're live.
Thank you very much. Good morning, everybody. Welcome to the Health and Wellbeing Board. My name is Michelle Legg and I'm a GP and I'm the clinical chair for the CCG, and I'm also have the honour and privilege of being the vice chair of this board. And Dave Stewart, who chairs, is not here today because he's attending a meeting virtually in London and asked me yesterday if I would chair in his absence, which I agreed to do so. So I think the first thing what we'll do is have a quick introduce to everybody. We have 15 members, and then I'll call your name out, and then if you could introduce yourselves, that would be great. And there is one anonymous person. So Christopher Ashman.
Yes, Chair.
Good morning. Would you just like to introduce yourself?
I'm Director of Regeneration at the Isle of Wight Council, Chair, with leadership responsibility on recovery planning.
Perfect. Thank you very much. The next one on my list, and I'm doing it across my list, is Murray Butler. If you'd like to introduce yourself and your role today.
Good morning, Marie Bartlett, Democratic Services Officer. I'll be producing the meeting that's being streamed live this morning.
Thank you very much, and thank you very much. Should be noted for your help yesterday, Marie. It was very helpful. Paul Brading.
Yeah, good morning. Councillor Paul Brading, the Cabinet Member for Children's Services, Education and Skills.
Simon Deere. Thank you very much, Paul. Simon Deere.
Good morning, my name's Simon Deere. I'm from Children's Social Care and I'm representing our Director, Steve Crocker, who sends his apologies.
Thank you very much. Welcome. Jill Kennett.
Hi, I'm here, Jill Kennett, representing Healthwatch at this meeting.
Thank you very much. Simon Holmes.
Hi, good morning. I'm Simon Holmes. I'm the Principal Social Worker for Adult Social Care and Housing Needs.
Julie Amies.
Yeah, good morning, everybody. Julie Amies, Chief Executive of Energise Me, which is a charity that is based across Hampshire and Isle of Wight, focusing on physical activity.
Thank you. Michael Lilly.
Thank you, Chair. Michael Lilly, I'm Chair of the Isle of Wight Voluntary Sector Forum.
Thank you very much. John Metcalfe.
Morning, Chair. I'm John Metcalfe, Chief Executive of the Isle of Wight Council.
Claire Morsdale.
Morning, I'm Councillor Claire Morsdale. I am the Cabinet Member for Adult Social Care, Public Health and Housing Needs.
Thank you, Claire. Steve Parker.
Good morning, I'm Steve Parker. I'm the Medical Director at the Isle of Wight Trust.
Just working down my list, bear with me. Charlotte Sadler.
Good morning, I'm Charlotte Sadler, Democratic Services Officer, and I'm clerk in the meeting.
Thank you. Alison Smith.
Good morning, everybody. I'm Alison Smith, Managing Director for the Isle of Wight CCG.
And then we've got a guest that says Anchovy. Anchovy. Could you introduce yourself, please?
I think it's Anchor Isle of Wight. Norman, is that you?
It is me. Hello.
I do apologise. Apologies. If you just introduce yourself.
For reasons that defy all logic, we still are identifying by an email address instead of a name. I'm Norman Arnold. I'm Chair of the Economic Development Board for the Island. Thank you.
Thank you. And we have somebody that's registered under Anonymous. Would you like to introduce yourself?
Is that likely to be me, Michelle, Sarah Jackson, District Commander for Policing?
Okay, that's probably that'll be good to know just in case you put your hand up. So welcome, Sarah. Thank you very much. Thank you.
I'm on the phone rather than on Teams, so I won't be able to put my hand up, but I'll shout.
Okay, you shout. All right. Marie, do we have apologies apart from Dave and Maggie Oldham said she's going to be a few minutes late? Are there any other apologies?
Yeah, we've had apologies from Steve Crocker, Carol Tozer, Emma Lincoln and Dave Stewart.
Lovely, thank you very much. The minutes I've looked through and think that they're more than accurate representation of our previous meeting. Does anybody else have any comments about the minutes that they would like to say at this point? I probably should have said that if you can raise your hand, that would be great. I'm hoping to be able to manage that, and then I know that John will help me if I miss something. The next thing is our declarations of interest. Does anybody on this meeting today have anything that they would like to declare that is new or pertinent to this agenda? No, thank you very much. I understand the next item agenda is public question time, and presently there are no public questions which should have been submitted by the 15th of March. The next agenda item is Chairman's update. I think what I would just like to say is for those that are tuning into this meeting, presently we're doing a verbal update because of the pandemic, and it might be a feel for a few people certainly that things are getting better, and thankfully they are. However, we're still actually very busy with COVID. We've got significant proportion in the community, and I can see on a daily basis that the hospital is still very busy. So we would continue with this format for the time being. So I'm going to move us on then to item 5, which is COVID-19 impact. And the first item on this is a general update, and we're hoping to receive an update from the Director of Public Health. Simon.
Good morning, Michelle. Apologies, I got stuck out the meeting with an update on Teams, so I will try and resolve that. I hope you can hear. I was going to share a short presentation that many of you are familiar with, but also, as you'd expect as Director of Public Health, to broaden that conversation out so that it's not just around, as you say, some of the kind of acute impacts of COVID, but some of the wider impacts, which will help us move into the further items on mental health and economy. So I'll go through it fairly quickly because it's been fairly familiar, and various people have seen this during the week. So just to look at our case rates, and just looking at the map on the right, we can see our rates have come down, noting the new scale. But actually we know that some rates are around the country are not coming down quite as quickly as others. So we're doing very well on the Isle of Wight, and you can see that we're in the lowest category here, and I'll give some more detail in a minute. But other areas are not falling quite so fast. So that, as you said, Michelle, how we really think about that, and as you say, we're still busy with COVID, but we're in a very positive position. And we look across the southeast, we can see that our R value is 0.6 to 0.8, showing our pandemic is decreasing. And then when you look across what we call ceremonial Hampshire, you can see the cumulative rates across the 4 authorities locally, with Isle of Wight here with a cumulative rate of 4,721 per 100,000. That's the total number of cases across our pandemic. So a large proportion, you can see the proportion of people affected there. And we look at our 7-day rates, we can see for the Isle of Wight it's 21.2. Because we have a low number of cases, we'll see that kind of bubbling up and down, because as we, 1 or 2 cases do make a difference when we're at this really positive low level. So in the last week, we've had 30 cases, but that's below the England and the South East value. But really just highlighting Yorkshire and Humber, I know it's a long way from here, but their rate is much higher. So across the country, it hasn't all come down. And as we are easing the lockdown measures, we just need to be mindful of that. And then you can see these maps from Public Health England. Note the slight delay in their data shows the rates across different parts of our local resilience forum areas. So Hampshire, Southampton, Portsmouth and Isle of Wight together, and you can see our rates there really positively all falling. Southampton and Portsmouth slightly higher than other rates, so we are working with our colleagues to understand that further. And then when you look at by age, you can see again in the height of the wave 2 that it starts from that younger working age population and then does affect other populations, which is one of the reasons that we really want to think about encouraging people who have to go out to work to get asymptomatic testing. And then, as you said, this is the published data. I looked this morning, it's not been updated. I know we have more local data, but the published data on the website shows that steady number of cases in hospital, not coming down around the Isle of Wight, but across our LRF area as well. And then when you look at ventilator beds, a similar picture with people in the main staying in ventilator beds longer. So that is a longer tail, but really important, and we've done very well there, and we can see it come right down from previous figures. And then sadly, when we move on to mortality, we can see now that our rate of death, the red bits being the COVID deaths, is now below our 5-year average. But at the peak of the second wave, we were well above our 5-year average for deaths. So we just need to understand that on a longer time period. And this table here I've picked out from a piece of work shows those people who are more likely to be impacted in terms of mortality by COVID. So those with previous health conditions, living in an area of deprivation, different regions of the country, and then the living conditions and our employment. So it's really important that we think about that as we move forward, and we progress the conversation later on this morning when we think about where we want to focus our attention as a board. And then I'll just quickly move on to some of the impacts which is felt in wave 1. We need to investigate further. The impacts on both physical and mental health need to be quantified, and I know we'll pick some of that up in the next presentation. But thinking about our drop in urgent care at the time, and I know it's improved in wave 2, but just think what's the long-term impact. So questions for us to think about. There were delays in treatment for cancer. We've seen immunisation and screening uptake. So things like that we need to think about in terms of how that's impacting our long-term health, which is after all what this board is about. And then I won't steal Leslie's thunder around mental health, but some of the mental health impacts have been helpfully classified by Hertfordshire, thinking about across the life course, some of those things that the pandemic will have impacted on mental health, both those serious illnesses, but also people dealing with mild to moderate and actually just mental, emotional well-being issues. So really important to consider those. And then finally, before I step into another presentation, which I don't want to take anyone else's thunder, but thinking about the impact of employment type on COVID. So we know some occupations, as I said, have higher risk of mortality, and some people are more able to work from home, so less exposed by the virus. And we know that some Black and minority ethnic groups are employed in sectors that increase risk of infection. So we thought, if we think about all those things, how as a board we want to tackle those going forward, and the next two presentations I know will help us think about that. So Michelle, I'll stop my part of the presentation and move back to you, and you can move through or happy to take questions.
Yes, I think we'll just ask questions on this, if that's all right, Simon. Does anybody have any questions or comments they have for Simon? And thank you for that presentation, Simon. It's excellent. I know that we're quite used to it, but it was a great representation of what's been going on over the last few weeks. Any comments on that? Michael Lilly's got a question.
Thank you, Chair. I won't put my camera on, but Simon, thank you for that. I've actually got 3 questions because obviously the public read things and obviously get worried about things, right? So one is about Portsmouth. There has been press publicity about a possible spike in Portsmouth in the summer, and obviously Portsmouth is an important gateway to the Isle of Wight, so there is concerns of that. My second question is about the Oxford. I think that obviously there's been a lot of national publicity about European countries. A lot of residents have had the Oxford vaccine, including myself, because I'm in the 60 category. And congratulations that we're now vaccinating people in their 50s. And the last question was about employment, because there are a lot of people who are very much poorer because of COVID. Example, a local family in my ward that were perfectly good, had a mortgage, 2 incomes, have now only got 1 income and are living on £600 a month, which is actually not paying their mortgage or, well, it's paying their mortgage and council tax, but very little else, which you can imagine. And the effects, and this is a family that's never come into the system before. You know, it's completely new within that, and that those families are really struggling within that. So those are my 3 specific questions. Thank you.
Thank you, Councillor Lilly. So just to pick up a couple of those points. So what we, if you look at the modelling, and I have to stress it's modelling, not what we know is going to happen, there is likely to be some kind of 3rd wave, or possible 3rd wave in summer. Likely is a bit strong. There's a possible 3rd wave in the summer, but as we've got a really strong vaccination programme, and as we are managing the social distancing, we are you know, understanding how that may impact on the spread of infection. So we are looking at all the data, and it may well be that we see an increase in cases as we open up society. It's unlikely to be on the scale that we had in the wave 2. That's not the thoughts, but really we just need to be mindful as we open up society, we're going to see more cases, and that's what we are preparing for, because we need to prepare for any eventualities. With regards to AstraZeneca, you're right, there was some concern around the blood clots. I can say there have been 17 million vaccines given of the AstraZeneca, and there have been around 40 or so blood clots, and that's less than the population in general. So the risk is lower, and I think we just need to really assure people that we to take up the AstraZeneca vaccine if that's what they are offered, and that's good to protect us against coronavirus, and that's what we want. Finally, on your employment and finance point, absolutely with you in this board, now having a representative from the the Economic Forum around the table means that we can really think about those longer term impacts of COVID, not just on the immediate health, but the change in people's economic status and employment status, because that's going to be really important for health and wellbeing going forward.
Thank you.
Michael. Thank you. Maggie Oldham's got a question for you.
Thanks, Michelle. I don't appear. I am logged in as Isle of Wight guest, so I don't know why I haven't got a hand on this. So apologies. Simon, just a couple of things from me. One is a question, and one is more of I'll start with my second point really, and that is, what are your 3 take-home messages from your report today? Because it'd be great to have the slides to just reread them, but and there's a lot of material in there, but if you could just help us by giving us the 3 top things that you would want us to take away. And my actual question really is about the vaccination supply. We heard on the news last evening, didn't we, that there might be some problems during April, and I was on a call last night with Simon Stevens, so I think I've had an update, but I think it would be helpful to just give us some context from your perspective about, is there any problems that you foresee with the vaccination programme in April? Thanks, Sam.
Thanks very much, Maggie. I think a couple of points there. So if I start with the second point, like you, I learned yesterday around the challenges with the vaccine distribution, and that's obviously something that we didn't want to happen, as we want to roll out the vaccination programme very fast. We are doing really well on the vaccination programme, and Alison Smith may want to comment further, but I think for me, if you're offered the vaccine, take it up. That's the right thing to do, and that will really help us to further prevent the spread of the virus. And I know that Alison and colleagues will be planning according to the supply, which I know they've been doing all the way through the challenge of, I think it's been described as a bumpy road. We'll be doing that, so we need to kind of consider that, and I don't think we know quite the implications of that yet, but we'll work through that. I think it's really helpful to think about those take-home messages. One is that I think, thank you to Ireland residents and all of us for actually we've managed this pandemic. You and your colleagues in the Trust, Maggie, have done a phenomenal job of caring for people, but our population has done, I don't want to call it work, great effort in managing social distancing, hands, face, space. I think what I would ask, and the message is, actually we aren't out of this pandemic. We've got a considerable way to go. We're easing out of our lockdown very, very carefully and cautiously, which is right, because actually we need to monitor and understand that so that actually we can make sure that we can keep our population healthy. And then I would also think about, please do follow the guidance. If any of the public are listening, follow the guidance that you've been asked to, because it's there for a reason, to prevent spread. And then I think our longer term plan for the Health and Wellbeing Board is to think ahead from now through to summer and through to winter. How do we make sure that we further protect our population during that time from coronavirus and other winter illnesses that will be coming through? So we just need to kind of think about that in the long term, but really we need to kind of consider all the measures we can to prevent spread of this virus. We've seen what's happened in other countries and we're in a very fortunate position now.
Thanks, Simon. Thank you.
John's got a question for you as well, Simon.
Thank you, Michelle, and thanks again, Simon, for the presentation. Simon, I wonder if you could just say a little bit more about the relationship between, or the ongoing relationship between testing and vaccinations, and also the particular need, if you like, to take care, heed the advice that we're still getting from government about, and why that's important. And that linked to, I think you almost alluded to it, the fluctuation in case rates that we're likely to see over the next 2 or 3 weeks, and why that might be.
So there's a number of things to play in there. I think firstly, we are seeing the impact of the vaccine that is impacting on our numbers, and that's really positive, particularly in those older age groups that have been vaccinated. We are going to see an increase in cases as society opens up, but also as we're doing more testing. So if you now secondary school pupils and their parental bubbles and those going out to work, you get asymptomatic testing. So we're picking up more people, which is really positive to break the chain of infection. But if we're picking up more people, that will be recorded as another case, which is not necessarily a bad thing if we pick that up, where we wouldn't have picked that up previously. And I think if we look back at the first wave, we were only testing people who were ending up in hospital. So actually we've got a different testing regime. So therefore we need to just reset where we are now and think we've got another great opportunity to understand how the virus is spreading, and let's use that. We do look at all the cases and make sure if there's an issue that we as a board and partners will be taking the right action. So I think you're right, we're likely to see an increase. With the vaccination also, people may be able to spread it, so they may still get, so that could still mean that there's more cases. So it's just kind of bringing all those things together to understand what the new data is telling us.
Thank you for that, Simon. I'm going to move us on now, and I know that you're going to speak later. If I move us on to mental health, is that you, Leslie, that's going to present this?
Thanks, Michelle. Yes, I from a mental health COVID perspective, I think I agree with all that Simon said. I think there are really 3 significant impacts of the pandemic on mental health. The first is the suppressed demand, so people not coming forward for treatment through lockdown because of the pandemic, and we're starting to see people now coming through having become more unwell because they've not been accessing services in a normal way. The second impact is direct impact of COVID, so we're seeing things, trauma, bereavement, the psychological impacts of lockdown having an impact on mental health. And the third and the longer lasting one will be the socioeconomic impacts, because we know the link, as Simon has just talked about, between unemployment and other socioeconomic impacts and mental health is really significant. We're currently seeing the same pattern of changes in mental health demand on the island as is being seen nationally, and so we're seeing an increase in demand for our acute beds, and we're seeing people coming through who've not previously been known to services and more acutely unwell than we're usually seeing, so higher acuity. We're also seeing an increase in eating disorders, both in children and young people and in adults. And again, that's in line with the national picture, and an increase in people coming forward in mental health crisis. There's a lot of work going on across the system, in particular to open up access to mental health services. I think access is really key, and you'll be aware we've got a no wrong door strategy, and in line with that strategy, we're trying to open as many doors as we can to give people as ready access in whichever way they're most comfortable with to get into mental health services, and then making sure that we're joining up the health, social care, voluntary sector and other aspects of mental health care so that people get to the right place in a really timely way. So, for example, we have now the integrated mental health hub that works very closely with the Safe Haven that allows people just direct access if they're in mental health crisis, but they can also access by phone and through the website. We're about to introduce a new platform called Sharon, that is a kind of interactive platform that will allow people to have direct contact with services. We're already extended our use of the 111 specialist mental health service delivered by South Central Ambulance Service. We get really good feedback about the support people get through 111. We're extending access to the voluntary sector, and we're doing a lot of work with primary care at the moment. There's been quite a significant rapid expansion of mental health practitioners based in primary care, but working very closely with secondary mental health services so that we've got some kind of seamless offer across the service. We need to keep promoting that, and we're working with our communications team about how to keep the message out there for the public about how best to access services in the way that suits them, is most appropriate for them. We're also thinking across the system about how we join up various pieces of work linked to public mental health and wellbeing. There's also great work happening around staff health and wellbeing across the system, and so I think drawing the connection between the kind of public health messages, the work that's happening across various organisations to support staff, and the mental health service inputs, I think will be really helpful to us. And so we're starting to make those connections now, which will, I think, further boost the offer available. That's all for me. Thank you.
Thanks, Leslie. Michael's got a question for you. Michael Lilly, Councillor Lilly.
Thank you. Thank you, Leslie, and thank you for that detailed of the wide vision and horizon that you're having on mental health, which is warmly welcomed. My question is about how we get the message over to people. There is a lot of people who've never been in or near mental health services. They've been very self-reliant, right? But they are now coming into that. You've got an increasing number of people who've been bereaved, not necessarily of COVID, but have had the kind of double whammy of being in isolation and actually losing a loved one without any family support other than through the telephone or Zoom, who are really struggling. I am seeing that in Ryde, who are very proud people who don't necessarily want to ask for help, don't want to admit to their distress really, but they are coming to a breaking point. There's a whole group of families that are really struggling on low income, again hadn't experienced this before, again very proud, and if you mention the word mental health, they clam up immediately with it. How do we get over very gently to our population on the island that it's okay to ask for help, and that we actually make mental well-being a priority, because that is going to be the barrier for a lot of people in rebuilding their lives.
Yeah, I completely agree with you. I think there's been a massive public shift, I think, in terms of attitudes to mental health, but I agree there's still a huge way to go. And I think one of the real challenges is that when people are mentally ill, when people get depressed in particular, that often comes along as one of the symptoms of the illness with feelings of shame. And so it's almost kind of built into mental ill health that it's difficult to access care. And so I think that the open conversations in our community about mental health, real kind of transparency and people being prepared to talk about it in a much more open way than has been the case in the past is hugely helpful. I think that there are a few things we were talking about, opening up lots of different ways of accessing services. So I think for some people, doing something in person is much more difficult than doing something online or over the phone, and so giving people those kind of choices is really important. We've been doing a huge amount of remote working. So our psychological therapies service, primary care psychological therapies service, for example, is entirely remote working at the moment. And actually we're getting really good feedback from people about it. And I think that enables people to access it in who might otherwise find it more difficult. And one of the other things that we're planning, we're not doing yet, but is going to come in the next year, is to open up a kind of cafe fronted service in Newport. So we've had some capital investment that means that we can buy a property that is big enough for us to have a cafe that would be a publicly open cafe, probably run by people with lived experience of mental health problems, that is really an invitation just to come in and access information, and if you want to access services, and it's that kind of very open, welcoming approach that we want to demystify mental health and really make the point that it's for everybody. So that those kind of ambitions, I think, are still there. We're pursuing them. I think it's taking us a while to get there, but I think they're on the horizon now.
Thank you, Leslie. I think Michael wants to have one more supplementary point, and then I'd like to move us on if that's okay.
Yes, I mean, thank you for that. Just in regards to a wonderful idea of having a cafe in Newport, I hope that you will also think of having cafes around the Isle of Wight, including Ryde and Sandown and everything. I know Michelle would like to see one in Ryde.
Yes, absolutely.
And actually, there is quite a lot of property that Ryde Town Council has bought recently, so there could be a conversation there. I think the particular, just a supplementary I wanted to make was, the physical thing. We need to be getting people out of the houses and able to get back into socialization and contacting. There's a lot of people who have lost their confidence to come out, right? And we need to really have some campaign to get people to get out safely, feel safe. I think various other issues that have happened recently regarding issues with women and violence, etc. We need a real safe message that it's safe to come out, and have lots of advertise lots of little activities, things, on the beach, different things which actually just encourage people to come out. Because if they stay in, and I'm, as you know, a retired trauma specialist, it is the longer they're in, the harder it will for people to come out.
I think just adding, I totally agree with you, Michael. I think that's probably a very could be really well picked up in 5D when Simon's going to talk about the physical activity plans and stuff. But we could look at the make sure that we combine that and always have that at the forefront. Was there anything else you wanted to say about that point, Leslie, or can we move on?
Thank you.
Other than that, I completely agree. Thank you.
Thank you very much for that, Leslie. Thank you so much. If I move us on then to 5C, which is the economic recovery and impact on health and wellbeing, and we're receiving a verbal update on this.
Thank you, Chair. Just a few words from me, Chris Ashman, Director of Regeneration in the first instance, and then our Chair of our Economic Board would just like to update on their thinking. As colleagues have already mentioned, the position regarding unemployment is of significant concern. We are at a position where the figures have been plateauing for the last few months, but obviously they are 5 times higher than they were at the equivalent time 12 months ago. And to some extent, they're also being impacted by the helpful extension of the furlough programme by UK government, which obviously is now extended to September to help in particular our tourism economy. But that being said, obviously the impacts in relation to the full impacts in relation to job losses are still to be felt. But in that context, we are anticipating obviously the need to continue to support businesses to recover and restart. And obviously through the lockdown periods to date, a significant level of government support has been given to our island businesses so that we can try and maximise the numbers of businesses that restart once restrictions in the roadmap are loosened. So over that period, £79 million has been spent to support businesses to come through the lockdown arrangements and restrictions, and that represents over 17,000 to those businesses. So clearly, as the roadmap begins to ease restrictions, continuing support around getting ready to maintain some restrictions and trade with the public will continue to be offered by our regulatory services departments to enable that we manage that in a safe and coherent way, and businesses do maintain the levels of hands, face and space agenda that Simon was referring to earlier on. We're clearly aware of the wider impacts in the community, and we've discussed obviously the issue relating to education recovery and our schools identifying how they will address those key issues, and we touched on obviously the impacts of mental health and the issues of losing employment on those issues. So the board is obviously cited on the recovery priorities. The key point from our perspective is that we had a regeneration programme pre-pandemic. The key planks of that are in place, and they are obviously going to support then the effective and focused recovery going forward. But if I could just hand over to the chair of the Economic Board, who will talk to you about the key priorities we see in the next 12 months.
Thank you, Chris. I think if we can look at 4 broad themes that have come out from our discussions that I think this board really needs to be aware of and can be very supportive, please, of. We've obviously put a lot of effort into job restart and small business recovery on the island. We've got skill training and we've got mentors employed now with a scheme that we're running jointly with the Chamber of Commerce, and anyone who knows anybody who could do with a quiet word, a bit of help. We're certainly here for that, and as a signposting as to where funding is, where training is, where help comes from. There's a really important piece of work to be done in selling the island offer, the quality of life we do, digital connectivity, but we really do have to look for something that makes us stand out from the rest of the crowd, because everywhere in the country is trying to sell itself on exactly the same things. So we really do have to look for what makes us unique, what is our USP, and how do we get that, and who are we aiming that at? As a piece of marketing of the island, it's a really, really key piece of work that we must crack on with. Another area that, again, it's something that everyone on this call is aware of because it's been talked about for so long, but maximising local spend is absolutely vital. We're talking here with the Isle of Wight Council and the NHS. That public money has been key to the island's economy and the island being an economy throughout the entire post-Second World War period. And with seeing the numbers of people and the kind of jobs within the NHS locally being cut, being downgraded, the prisons being downgraded, the amount of money in the local economy actually goes down. But that money being spent locally and circulating locally, and the effect that has on small business in particular, is absolutely vital for the island. And we really must start to think more carefully and more creatively about how we are actually buying goods and services, how we're doing it, where it's from, how that can benefit the island. And the other thing is that we feel it's really, really important to try and embed the spirit of the pandemic, this social capital that's built up. It's been one of the few real positives of the last 12 months, is the way that people and a lot of communities on the island, especially our smaller communities, we all think and talk about Ryde, Newport and Sandown, but it's your Chillertons and your Bembridges and your Bradings, and the places where people are actually coming out, they're volunteering, they're working really, really hard for their communities, and that sense of community, of the spirit of community, that actually is the broader point about what an economy and our society is about. And I think everything we can do to support that, and really interesting hearing some of the things being talked about today already. So thank you everybody, and let's see where we go.
Thank you so much for that. I couldn't agree more with that, trying to bottle that community spirit and keeping it, because we really have seen people do amazing things over the last month, and our volunteers have been absolutely incredible, from everything from collecting shopping to really supporting with the vaccination programme, which we could not have done without our volunteers. So from my point of view, I thank them at every opportunity, but there will be something about that community spirit as well, and to try to continue that. So I couldn't agree more with that. So thank you so much for that. In the chat, I can't see that there's any more questions on that. So I'd like to move us on to 5D, which is about the physical activity report, Energise Me. And I think we're handing back to Simon for that. Thank you,
Many thanks, Michelle. It's a great pleasure for me to kind of open this piece of work, but really it's work in partnership with Energise Me, who are a physical activity and exercise champions and partners. And as we've discussed previously, the impact of the pandemic has been dramatic on many areas of our lives. And I think about physical activity and physical inactivity. It's the best buy for public health. It's free, it's out there. How do we increase physical activity in our whole population? Could actually be really good for everybody. So I hand over to Julie Ames from Energise Me, who's going to take us through this presentation.
Morning everybody, thank you Simon. I think Marie's going to share my slides because my old Mac is not really up to it. Thank you Marie. So just while we're getting the presentation set up, I want to just say that in the next few minutes, what I'm going to do is share some really strong physical activity data for the island, actually. I mean, you've got a wonderful island where you've got many opportunities to be physically active, and maybe that's why some of your data is quite strong in some cases. But what I'm going to urge is some notes of caution in the context of COVID and the impact that that's been having on people's physical activity levels during the last year. I'm going to share some stories about local people whose lives have been changed through physical activity, because I think it's really important that we hang on to people and the fact that we can bring about change in people's lives if we just think about it carefully in the context of our work and each part of the system that we work in. And then I'm just going to finish with some new information that's come to us in the last few weeks since this report was originally written. So Simon has mentioned that we are Energise Me, which is a physical activity strategy. And if you just flick on to a physical activity strategy, an organisation, a charity that's focused on physical activity. And the next slide, please. We are an organisation that exists to beat inactivity. And the next slide, please. And then I will slow down. And we build happier, healthier and stronger communities. So the next slide, please, Marie. So back in May 2020, Professor Michael Marmot said this: once lockdown went into place, it exposed the fault lines in society, those who could work from home and those who could not, those who could retreat to holiday homes and those in crowded flats, those with income reserves and those who could not afford to buy food, those in a position to offer home education to their children, and those not so fortunate or well equipped. And I know that you're all quite capable of reading that, but when you say the words out loud, I think that has an impact and just reminds us how challenging this has been and how inequalities in our society have really been exposed through the COVID period. And the same is true for physical activity. Lots of people's lives have been affected by COVID, and physical activity levels have been impacted along the way in just the same way. So the next slide, please, Marie. So this slide, I know it's a busy slide and it is in the as an appendix in the report, but this is just a timeline to illustrate how the sector responded very, very quickly to COVID and the first lockdown and subsequent lockdowns since. We had two objectives right at the start of COVID. One was to support people to stay active at home and when leisure facilities and clubs and various things were closing down. And the other was to support the sector. And within this timeline, you can see some of the things that we did. So the day after government announced that everyone should stay at home, the Get Active at Home website and resources were posted. School games organisers very quickly took activity online to support schools and children and young people. COVID research got underway, which has been really helpful because we know that 20% of people have said that across all demographics have said that they are less active than what they were before lockdown. We've had some Investing in Communities fund to be able to support voluntary sector and other organisations to help keep people active during this period. And that's not been just about physical activity organisations, it's been about charities that might be working with people with learning disabilities and who may not have access to be active, and so they've been doing things either online or when we started to open up some walk and talks and such like. So that's been a hugely helpful resource to us that's been devolved from Sport England to help different organisations across the whole of our area. And I know again in the pack that you've got a couple of examples of work that's taken place on the Isle of Wight. We also got our new strategy work underway during this period, and back in December the National Recovery Fund was launched to help leisure facilities, and I know that the island were looking to make an application. What I don't know is what the outcome of that is yet. I don't know whether John does, but I don't at the moment. So next slide please, Marie. So this is the good news that I was talking about. So your inactive population on the Isle of Wight is approximately 26,000 people, and I can tell you that that is better than England's average. It is better than Hampshire's average. When we measure this against your 5 nearest neighbours, you're the first of 5. So you're doing really well. But if you look at this, you do have 14,000 people on the Isle of Wight that are doing no activity at all, and some that are doing 1 to 29 minutes. And that's the definition of being inactive. People who are doing less than 30 minutes of activity a week. And what we don't know is too much about is children and young people. This only measures adult activity. We don't have good data on children and young people yet, I should say, but we hope to do better on that. But certainly all the data that we did, the proxy data that we did have, was telling us that children and young people were being really badly affected through the COVID period, because some of those natural ways that we can be active, walking to school and so on, were just removed as we went into lockdown. So next slide, please, Marie. So here's your inactive population by demographic group, and it just gives you an indication of the different numbers in the different groups. Next slide, please, Marie. And if we map those inactivity levels across the island, you can see those red areas are where your highest levels of inactivity exist. And for those of you on the call that know your island very well, you might look at those areas and say, as well as physical activity inequalities, there may well be other inequalities that exist in those communities. And it's this layering up that really kind of makes the difference when we look at what we do in our work. So just moving on now to some of the case studies. So next slide, please, Marie. I want to introduce you to Doreen, who is a resident on the Isle of Wight. Doreen had childhood measles, which caused some breathing problems, but she was always active. And 15 years ago, she had a severe chest infection and became confined to a wheelchair and had to have the support of oxygen. But with the support of her local GP, who referred her to a consultant on the mainland, she was encouraged to take activity back up, but to take things slowly. And this is where the Be Active, Breathe Easy unit and Andy there, who supported Doreen, became really important to help her back onto the road to being physically active. And today, Doreen rides a bike, she gardens, she walks regularly, and she has started Tai Chi. But when I read this full case study, the thing that also occurred to me was that Doreen does some of those bike rides with her husband. And what that means is that not only has Doreen's quality of life been improved, but that of her family as well, because they can now share these activities. So moving on to the next slide. So this is Sophie. She doesn't reside on the island, but she's one of the people who during the lockdown found Couch to 5K, which is a free app available through the NHS. There was an explosion in the download of Couch to 5K during the first lockdown. Something like 860,000 people downloaded that app between March and June, and that was up 92% on the previous year. But in Sophie's case, there were the two drivers for Sophie to become active. One was the fact that she didn't have any not very much outdoor space where she in her own home, so she wanted to get into the outdoors. And two, she'd seen that some of her friends were taking up challenges on social media, and so she wanted to kind of keep up with them. So Sophie's is a regular runner now. And as I say, sometimes it can be really simple and quick solutions that can help people become active. And the next slide, please, Marie. This is Ros, who's a physiotherapist in one of our local hospitals. And the reason I wanted to highlight this is because in all of your workplaces, oh my goodness, sorry. In all of your workplaces, you will have people like Ros that are not just working, you know, as workers in your places, but they also have other interests. And in Ros's case, she's got a little business that is called Love to Move, and she takes her kind of expertise, I suppose, into the community to help people with long-term conditions to stay active. And the next slide, please, Marie. And this is my last case study. This is Christine, who again is helping people with long-term conditions to stay active through the lockdown period. She specialises in GP referral for old people and some of the chronic conditions. But what Christine was able to do was to quickly take some of her classes online. And I know that there are people that are digitally disadvantaged and can't always access online activity. There are those that don't particularly like online activity, and interestingly, quite a lot of our children and young people have reported that. But there's many more that have also reported that it's really helped them to stay active during this period, and that's really crucial. And I suppose it speaks to Michael's point earlier about how do we build confidence and get people back out after this period of lockdown and rebuild confidence to get people moving again. And finally, on to my penultimate slide, and this is the recovery phase really, that we are talking with the integrated care system about their refreshed prevention plan, and we're looking to, well, not looking to, we have included, hope, fingers crossed, a line on physical activity in there to build that into, I am so sorry, I can't unplug this phone in the office. Yeah, so so we're looking to build it into the care pathways of physical activity into the care pathways to help with recovery. We in January took on a role to across the region to support social prescribers. It's with Sport England, but other partners like the Arts Council and others with the National Academy of Social Prescribing to be able to build a kind of wealth of activities so that people can become active in ways in which they want to. So we're trying to build up the opportunities that are available for social prescribers to signpost people to. We hope to hear very shortly about opening school facilities where we are looking to receive investment of 283,000 to reopen schools in Hampshire and Isle of Wight, and that's primarily to be able to help children and young people recover in the context of their physical activity levels, but also the wider community. And finally, next week on the 30th of March, we've got the final phase of our Hampshire and Isle of Wight strategy. We've got over 200 people signed up to help us with that workshop to make sure that we've got people's as well as organisational voices in the design of that strategy. And we've got people coming from transport, from planning, as well as from leisure and local authorities and health colleagues and so on. So we're looking forward to that event next week. So finally, I hand this over to the board now to say, you know, from your experience, what action can we, our organisation, our networks do to help communities be active to, and particularly to recover out of this period of lockdown and the virus? Thank you.
Thank you so much for that. That was amazing. So thank you so much. Simon, do you have any further comments you'd like to make, or we open it up for discussion?
I think, Michelle, I know we're fairly pressed on time, but open up for discussion. And when we think about our new strategy, how do we take this forward? As I said, physical activity is a great thing for our health and well-being. So how do we really think about that as Julie's challenged us to improve our health and well-being going forward? But I'll stop there to take other comments.
Yeah, I mean, I think it overlaps everything from everything that we've discussed about, from the year that people have been inside with reduced mobility generally, and then people that have actually had COVID and have now a rehab plan, to people's mental health, to our children. And my view, if anything, if we could just focus on one thing, on activity, would actually mushroom out and cover quite a lot of other areas that we've got concerns about as well. But does anybody else have any other comments? I know we're a bit pressed for time, but we can often discuss this in our next meeting on strategy. So any other comments from anybody? Yes, John?
Yeah, thank you, Michelle, and Julie, thanks very much for the presentation. That was really, really interesting. I wanted two things I might just sort of test you on or take your views about. I think the first one for me is something like the Couch to 5K is absolutely brilliant, but is it almost too aspirational for some people who we just need to get outside and walk around a little bit? And what do you think could we do for those sorts of people? And secondly, was there anything coming out of your research that talked about the real barriers about physical activity or getting people outside? Because sometimes it's just the word activity that people lose. You sort of gets, gives the impression of hot and sweaty people running down the road, and of course it's not like that. And how do we change that perception as well, and help people to understand that any kind of activity is good? And I know there's been a lot done over many years, but I think we still have a barrier to cross with that one, don't we?
Yeah, definitely. I mean, two really good points there, John. I mean, one of the things that, one of the things that we've change probably in from 3 or 4 years ago is very much to focus on these words, physical activity, or even some might talk about just moving more, and trying to strip it right back to everything counts. I think one of our case studies on our website is about a woman who builds housework into her daily life as her means of being able to be physically active. We've talked about gardening, and that's one of the things that we're doing with the social prescribing, making sure that we are curating a range of opportunities that do feel very accessible to people, which could be just simply, you know, getting out. And in Doreen's case, she started with, you know, a few steps and built on that, and that's what we are really keen to promote. And we've in our particular case, if you look at our website, we've really changed how our website looks, the type of images that we have on those websites, to make sure that we break down those barriers and change people's thinking that it doesn't have to be, you know, you have to be technically good with a racket and a ball in order to be able to be physically active on a tennis court or whatever. So yeah, just making it as simple as possible for people to become active. And then the barriers to activity, that's one of the things that we did in the big online conversation just before Christmas, to make sure that we brought audiences, people's voices into the strategy to understand what some of those barriers are. We do have a kind of range of comments from people from across Hampshire and Isle of Wight, from different groups of people that have given us some really good material, and we've used those comments and those contributions from those people in the community to be able to set up the workshop. We've also invited those people into the workshop to make sure that people and communities' voices are there. But you spot on, there are lots of things, you know, even just like safe walkways, you know, lit walkways to help people to walk. And I suppose that's very topical with the events of last weekend, for women to feel safe, to be able to go out in the dusk or evening, to be able to walk streets safely, and so on. So very much bringing those kind of barriers into the discussion to be able to write the next strategy.
Thank you so much. So we're being asked to obviously consider this, to accept your report, which is obviously, you know, it's a really, really informative report, and but we're also being asked to adopt the next Hampshire and the Isle of Wight physical activity strategy as part of the board's strategic priorities for health and wellbeing. And I'm assuming that we're going to discuss about that in our next part of our meeting. This is a public meeting, so we'll be closing this shortly. So it leaves it for me to say thank you so much for coming today, and thank you for that report, and I'm sure we'll be in touch soon. All right, thank you.
Thank you.
Lovely, thank you. So that brings us to the end of our meeting. Did anybody have any other business, members' question time, or any other business?
Just to let you know, Chairman, that I've received no members' questions.
Okay, lovely. In which case, nothing. Right, lovely, thank you. In which case, I would like to say thank you to everybody for your time today, and we'll see you shortly. Take care. Bye-bye.
Bye.
Thanks, Michelle.
Thank you.